Hello everyone and welcome to my channel. In our continuing discussion on the new drugs which have been approved by the US FDA, today we are going to discuss about the drug that is known as Zavegepant. We will be covering our topic under the following points of discussion. So let us take one heading at a time. To start with, let us have a discussion on the calcitonin gene related peptide or CGRP. Now this CGRP, it is a 37 amino acid neuropeptide. The action of the CGRP is mainly localized to the C as well as the A delta sensory fibers. Now this CGRP, it is the most potent known vasodilator in the human body, and it dilates the peripheral as well as the cerebral blood vessels. Now we all know that the dilation of the cerebral blood vessels is the main pathogenetic mechanism which ultimately leads to the development of the migraine. So what is the main source of CGRP? This CGRP is basically released from the cell bodies of the trigeminal ganglia. And how is it released? Once there is activation of the trigeminal nerve, then because of this activation, CGRP will be released from the perivascular nerve endings. Now why will there be activation of the trigeminal nerve? This trigeminal nerve will be activated because of the neurogenic inflammation that occurs during the migraine. There are two forms of this CGRP. First one is the alpha CGRP and the second one is the beta CGRP. The alpha CGRP is also known as CGRP1 and the beta CGRP, it is also known as CGRP2. Now both these alpha and the beta CGRP, they are actually synthesized from two distinct genes, and these genes are located on the different sites on chromosome number 11. The serum half-life of CGRP varies from 7 to 10 minutes. And the alpha CGRP is the main CGRP that is responsible for the development of migraine, because alpha CGRP is found in the central as well as in the peripheral nervous system, whereas the beta CGRP on the other hand, it is found in the enteric nervous system. Let us talk briefly about the CGRP receptor. The CGRP receptor is a complex which is made up of three subunits. Now the first subunit is a calcitonin receptor-like receptor or the CLR. This CLR is the one which has the GPCR or the G protein coupled receptor activity within it. There is a detailed discussion of GPCR. The link to the video will be given in the description box below. The second subunit is a receptor activity modifying protein or RAMP1. Now there are three classes of RAMPs, RAMP1, 2 and 3. Among them, the calcitonin gene related peptide or the CGRP receptor, it has the RAMP1 subunit in it. And the third subunit is the receptor component protein or RCP. So what is the main action of RAMP1? The RAMP1 is the protein that is mainly involved in the transportation of the CLR or the calcitonin receptor like receptor to the plasma membrane. So once the transportation of the CLR occurs into the plasma membrane, then there is a formation of the heterodimer. After the formation of the heterodimer, there is the creation of the full receptor complex and ultimately the agonist binding. And what is the action of RCP? The RCP is the protein that is mainly involved in the intracellular G protein signaling. When we look at the structure of the CGRP receptor, we are going to understand it in much more detail. So as we have already said that the CGRP receptor has got three subunits. The first one is the RAMP1, the second one is the CLR or the calcitonin like receptor, and the third one is the receptor component protein or the RCP. So this RAMP1, what it is doing is that it is basically helping in the incorporation of this CLR into this plasma membrane. So once the CLR is incorporated into the plasma membrane, there will be a formation of the heterodimer between the RAMP1 as well as the CLR. And once this heterodimerization occurs, then this CGRP protein will be able to bind to its receptor. So once the CGRP protein binds to the receptor, then with the help of this RCP protein, the G protein coupled receptor component will be activated and there will be further downstream effects. Now let us have a look at the role of CGRP in migraine. As we already know that because of migraine, there will be the neurogenic inflammation. And due to this neurogenic inflammation, there will be increased release of CGRP protein. Now this CGRP protein will be released from the trigeminal ganglions. So once this CGRP protein is released from the trigeminal ganglions, this CGRP protein will bind itself to the receptor. And once the CGRP is bound to the receptor, there will be the stimulation of the G alpha subunit. Because of the stimulation of the G alpha subunits, there will be the stimulation of the adenylyl cyclase. This adenylyl cyclase that has been stimulated will lead to the conversion of ATP into cyclic AMP. So now the level of cyclic AMP is going to be more. So this cyclic AMP is going to function as the second messenger system. Due to this cyclic AMP, ultimately there will be the activation of the protein kinase A and there will be the opening of the ATP sensitive potassium channels. Now due to this mechanism, there will be the development of hyperpolarization. And once there is a development of hyperpolarization, then we are going to have vasodilation. And this vasodilation will be responsible for the development of headache that occurs in the patients of migraine. There is, however, one additional action of CGRP as well. The CGRP acts also by the endothelial receptor. So once there is increase in this level of cyclic AMP, this will also lead to the production of nitric oxide. This nitric oxide is going to diffuse itself into the smooth muscles. After the diffusion of the nitric oxide into the smooth muscles, there will be the activation of the guanylate cyclase. This guanylyl cyclase is going to convert the GTP into cyclic GMP. And this cyclic GMP is now going to function as the second messenger. Now because of the increase in the level of cyclic GMP, ultimately there will be relaxation of the smooth muscles. So the CGRP is basically causing vasodilation, be it by the action of the G protein coupled receptor or even with the help of the nitric oxide. So what is the mechanism of action for the new drug Zavegepant? This Zavegepant, it acts as an antagonist to the calcitonin gene related peptide or CGRP. So the vasodilation that has been caused by the action of this CGRP, that vasodilation is counteracted against. And as I have already told you that the development of vasodilation is one of the main pathogenetic mechanisms for the development of headache in migraine. So if the process of vasodilation is counteracted, then the patient will get relief from the headache. The drug Zavegepant, it is used for the acute treatment of migraine with or without aura in case of adult patients. However, Zavegepant is not used for the preventive treatment of migraine, or in other words, this drug can be used for the acute treatment of migraine, but not for the prophylaxis of migraine. The recommended dose for this drug is 10 mg, which is given as a single spray in one nostril as needed. The maximum dose within a 24-hour period is also 10 mg or one spray of this drug. The maximum use of this drug is for treating 8 migraine headaches in 30 days. Now the safety of this drug beyond treating 8 migraines in 30 days has not yet been established. This drug is available as a nasal spray with one spray emitting 10 mg of the drug. The adverse drug reaction that occurs with the use of Zavegepant, the most common adverse drug reaction is hypersensitivity reactions. Now, the patient can have either facial swelling or urticaria as hypersensitivity reactions. There can be taste disorders such as dysgeusia or ageusia. There can be nausea, nasal discomfort and vomiting. The salient pharmacokinetics of this drug are as follows. The peak plasma concentration is achieved in approximately 30 minutes. The bioavailability of this drug is approximately 5% after a single nasal spray. The volume of distribution is 1774 liters. And the plasma protein binding of this drug is 90%. Now we also have a detailed video on bioavailability as well as volume of distribution. Feel free to check it out. The link will be given in the description box as well as on the I button above. This drug is primarily metabolized by the CYP3A4 system and to a lesser extent by the CYP2D6. And the half-life of this drug is 6.55 hours. Now what is the status of this drug for use in specific populations? The drug must be avoided in patients who have got severe hepatic impairment as well as in patients whose creatinine clearance is less than 30 ml per minute. Intranasal decongestants, they are best avoided along with ZAVZPRET. However, if we do need to give the patient intranasal decongestant, then it is better to give the intranasal decongestant after at least 1 hour after the ZAVZPRET has been administered. So to summarize everything that we have studied, the drug that we have studied today is Zavegepant. The Zavegepant, it is available under the brand name of ZAVZPRET. It is available as a nasal spray with one single spray emitting 10 mg of the drug. The route of administration is obviously nasal. It was approved by US FDA on 3rd March 2023. This is a calcitonin gene related peptide or the CGRP receptor antagonist, and this drug is used for the acute treatment of migraine with or without aura in adults. However, this drug is not used for the prophylaxis of migraine. So that's it for today. If you like this video, then do give it a thumbs up and share it, and subscribe to my channel and press the bell icon so that you don't miss out on any upcoming videos. And also do let me know down in the comments below what other topics you would like us to discuss. Until next time.